Okay, well, let's get started. My name is Mike Grusak. I'm a senior advisor with the USDA. I'm a senior advisor with the USDA mission area on research, education, and economics, and I'll be moderating the event today. We look forward to today's conversation, and please note that our team will be placing links in the chat throughout the webinar to important information that you should watch for. So watch our chat box. Now it's my pleasure to introduce Dr. Chavonda Jacobs-Young, our USDA Chief Scientist and Undersecretary for Research, Education, and Economics, Mission Area. Dr. Jacobs-Young, please start the event.
Good morning. Thank you, Dr. Grusak. Welcome and thank you for joining USDA's Cancer Moonshot Community Conversations event, focused on cancer prevention through healthful eating. Now, this event is part of the White House Cancer Moonshot Community Conversations Week of Action. That's right, there's an entire week of action around this very important topic. Federal agencies across government are highlighting our collective efforts to end cancer as we know it. We're here to discuss USDA's progress on efforts to prevent diet-related cancers and other diseases through tailored, science-based, evidence-driven food and nutrition research, community engagement. We're also excited to make a major announcement today, and that's right, you'll be the first to hear about how we're taking our work to the next level. More to come on that shortly. I want to thank our community partners who are joining me in this conversation today. They will share the challenges that their communities are facing and the opportunities they've seized upon to advance better health by paying attention to what's on their plate. Now, as Dr. Grusak mentioned earlier, this is a community conversation. So you'll have a chance to ask questions and share your thoughts on how USDA can best advance our efforts to help all of us live healthier lives unburdened by diet-related disease. Let me first set the stage by offering a brief overview of our efforts, and then I'll introduce our panelists. President Biden's Reignited Cancer Moonshot initiative to end cancer as we know it outlines 5 key goals. And one of those goals is including preventing cancer before it starts. At USDA, we know it's imperative that we recognize and educate communities about the vital role food and nutrition play in preventing diet-related diseases, including some cancers. Understanding the importance of this nexus between engagement, research, and data as they relate to nutrition, Secretary Vilsack and I launched a new initiative in 2022, USDA's Agricultural Science Center of Excellence in Nutrition and Diet for Better Health, or ASCEND for Better Health. ASCEND brings together scientists, partner organizations, and communities to deliver the latest science-based solutions that promote and elevate food and nutrition security for all Americans, not just those who have access to and can afford to pay nutritionists and dietitians. ASCEND is designed to enhance collaborations across USDA and our university and community partners in a way that injects a deeper understanding of the connection and capacity of food to prevent cancer and other diseases. Last year, we held listening sessions across the country to hear from people with lived experiences. We convened conversations with an African American community in Baton Rouge, Louisiana, a Hispanic community in Laredo, Texas, a tribal community in Bismarck, North Dakota, and youth leaders from across the nation who are members of the 4-H organization. We listened and learned that each of these communities has different nutritional needs and different traditions. They eat foods that are a part of their family heritage and cultures, often passed down from generation to generation. That makes their habits and their experiences with food unique to them and their communities. Also, during our ASCEND community listening session, we asked participants to share their lived experiences with us, and we're pleased to share some of those with you today. Interspersed through our panelists' remarks, we'll play videos of different community members sharing their stories about healthful eating. These are a part of our larger library of videos that you can view online today at the ASCEND website. We're using the information we learned from the community listening sessions to refine and develop evidence-based research unique to those communities to help them make informed decisions about their food choices. Now, before I move on, I want to share my own story and why I am so passionate about this topic. And perhaps my story will ring true for some of you. Today, we know that many preventable diseases are caused or exacerbated by what we eat. But growing up, I didn't recognize the impact of our food choices on my own family. In Georgia, my Georgia household, we fried everything, and I mean everything. Accompanied by collards with ham hocks and macaroni and cheese with real cheese and evaporated milk and gravy, lots and lots of gravy on everything. Even our breakfast oatmeal was topped with butter, evaporated milk, and sugar. This pattern of eating was common throughout the South and other parts of the country that have their own distinctive food cultures. In our family, this intergenerational approach to eating took a deadly toll. I never met my paternal grandmother. She died before I was born, just 50 years old. My children never met her son, my father, their grandfather. He died from colon cancer, discovered way too late for life-saving treatment, 3 days before the birth of his first grandchild. He was only 51 years old. My maternal grandfather and grandfather died in their 50s from heart disease. We lost my sister at age 50 to COVID, which she was more vulnerable to because of multiple chronic diseases and health problems. Despite all I do to try to minimize them, I have my own health concerns. I was only 20 years old when I was diagnosed with hypertension. And let me tell you, I was in great shape. I was a 3-time ACC track champion, and yet here I was diagnosed with hypertension. I had a genetic predisposition for hypertension. And maybe had I known what I know now, I may have been able to ward off the hypertension through a healthier diet. Now, as we traveled around the country talking with communities about their challenges with nutrition and healthy lifestyle, I learned that my story unfortunately rings true with many people. In listening to communities, we learned that lifestyle factors and lack of access to clear, concise, current, credible information delivered by trustworthy messengers, among other things, are the main reasons people struggle with improving their health through nutrition. We also learned that social environments and cultural influences are important in making food choices. We concluded that the path to improved health through nutrition and diet may vary, and that we need to meet people where they are, through people that they know and trust, with knowledge that is tailored to their unique experiences and lifestyles. Equipped with that information, we announced a pilot nutrition hub in September 2023, tailored especially for the African American community. This partnership between USDA and Southern University was the best and latest science, using the best and latest science to develop information and resources people can understand and use to make informed decisions about their food choices. This pilot nutrition hub supports commitments made during the historic White House Conference on Hunger, Nutrition, and Health, which outlined a strategy to prioritize the role of food and nutrition security in overall health, including disease prevention and management. Through dedicated outreach and engagement efforts, the Pilot Nutrition Hub strives to improve health equity by enabling community groups and leaders to better understand and integrate USDA-funded nutrition research in culturally responsive ways. And the Hub strives to meet people where they are, with nutrition information tailored to their lives. Now let's meet today's panelists, all who took part in our Ascend for Better Health community conversations over the past year. They will share their personal reflections on these community engagements and the impact on their communities. So before I introduce our first panelist, we're going to play the first short video.
I'm the Food Sovereignty Coordinator at United Tribes Technical College, and I grow food, I eat food, I preserve food. I am involved in every aspect of food production because I am food sovereign. Most indigenous people all over the world talk about the 7th generation and not just thinking about the next generation, but thinking 7 generations ahead. And that's really what I'm trying to do. But I'm not trying to change the world tomorrow. Even though I'm thinking 7 generations ahead, I realize that changing our food system, changing the way we eat takes time. My advice is to just be gentle with yourself and realize that it's going to take time. Make small changes. Instead of eating canned sweet corn, try to start incorporating your indigenous varieties of corn into your diet every day. Just make simple changes in your diet, and those will eventually lead to big changes in your life.
Our first panelist, Mr. Edwin Kitzes, is the Land Grant Director for the United Tribes Technical College in Bismarck, North Dakota. He leads the Sustainable Agriculture and Food Systems Applied Science degree program and all the food sovereignty, food production activities on campus. Edwin earned his undergraduate degree in agriculture from New Mexico State University and his graduate degree in public administration from the University of New Mexico. Welcome, Mr. Kitzes. It's good to see you again. Please tell us which listening session you attended, share a little about yourself, your experience at the event, and how it impacted your community.
Good morning. Good morning. Thank you. My name is Edwin Kitzes. I am the Land Grant Director at United Tribes Technical College in Bismarck, North Dakota. We are one of 35 tribal colleges and universities across the country that serves the majority of Native students and their families and their communities. And it was our honor last year in June to host one of these listening sessions on our campus. It was a great turnout. We had about 100 people, which included tribal members from across the state. Many drove 200 miles from their location to participate. We had our student body participate, which is also a diverse group from many tribal nations across the country. So it was a great sort of representation of the tribal colleges in general. And this was last June. And let's see. So one of the big takeaways we got from our listening session that was highest on what most people were saying is accessibility of nutritious food in Native communities, which oftentimes are very distanced from cities and other locations. So food choices can be very limited, and families who do have the food, families when they do purchase their foods, they have to plan in advance and purchase all of them maybe in at a week at a time, and they only have very limited places they can get their food. So this was good to identify, because we could sort of focus more on what we need to do to provide better nutrition and better education on what kind of food that the people need to eat. Let me see what else. Yeah. So it was a very good event, and thank you again. I will be here for questions and answers at the end of the webinar.
Thank you, Mr. Kitzel, for your comments and sharing some of the outcome of the listening session in your area. Now we'll share our next video.
When I was younger, I was a little on the heavier side, but it's just because I loved food and I loved eating everything that I saw. But growing up, having more self-control and realizing that just because you're stressed or just because you're bored doesn't mean you have to eat like the whole pantry, right? And I just wanted to come on here to encourage you guys to care about your health. I know life is crazy and life can get hard sometimes, but taking that extra step to not drink a soda can really go a long way. for your future families, your future health, and your future endeavors. So yes, I think taking care of your health is very important. When you feel good, you know, life is good. And when you eat clean and healthy, you feel better about yourself and more energized.
Wonderful. Now let's turn to Ms. Andrea Masonette Sanchez, a plant pathology intern at the USDA ARS Research Center in Fargo, North Dakota. Ms. Masonette Sanchez is a Puerto Rican 4-H youth leader. Since 2016, Andrea has been working in 4-H with environmental projects at the U.S. Forest Service. While pursuing bachelor's degrees in microbiology, she has been part of the honors program, president of the microbiology chapter affiliated with the American Society of Microbiology, and a member of the Society of Toxicology. Welcome, Ms. Masonette Sanchez. It's so nice to see you again. Please tell us which listening session you attended. Share a little bit about yourself, your experience at the event, and how it impacted your community.
Thank you so much for that introduction. It's nice seeing you again. So part of what I did with Ascend with for Better Health was in the National 4-H Conference in Washington, D.C. last year. I've been participating in this conference for the last 3 years. And last year I got to work with this topic with delegates from all around the country. And we had a question to answer on how the USDA can engage youth to have better relationships with food and healthy lifestyles. As a facilitator, I encourage them to do the research, to also share their experiences by what they see in their community. And the most powerful part of this job is just seeing how they fell in love with the topic and how they felt confidence with what they were doing. Part of 4-H is learn by doing. I was there to facilitate. I just encouraged them and helped them and guide them. We all know by now that the youth are the future of our nation, but education is not, it's sometimes not enough. We have to encourage them. We have to tell them that we believe in them, and the work is there for them to do it, and there's different ways that we can encourage them to do it. So with my experience in 4-H, that's how we developed the topic. We mentioned different aspects of what is happening currently in our nation. They gave their perspective, again, based on research, but also personal experiences, what they saw in their schools, what they saw statistically. Also, one of the things that's very interesting that they mentioned, I helped them, but it was food security, mental health, and the relationship that they have with food, and also education. One of the other things is that they mention is a lot of people don't know how to read the nutritional facts labels. So those are the things that our youth are highlighting. So I feel like it's very important to pay attention on what they have to say, because they are the ones, like, they're living in our communities, and these are people from all around the nation. So encouraging our youth and making them part of this initiative, I think it was one of the most important things, because some of them knew, like, about food and health and all this stuff. Some of them didn't, but all of them went back to their community saying, I love this topic. I want to bring it back to my community. I want to talk to my friends, to my family, to my 4-H leaders to make it better. So it is so, I think that the collaboration between this event and 4-H is so important to encourage youth to provide more information to the communities and also be more engaged with what's happening in our country. So if you have any questions regarding this experience, I'll be more than happy to answer them.
Thank you so much, Ms. Masonette Sanchez, and we look forward to you participating in the Q&A session at the end of this section. Now we'll share our next video.
United States Department of Agriculture.
I say we can't really control what other people cook and how our uncles barbecue, but we can start differently. We can start off with vegetables, work your way up, start sauteing them like a regular dish. All I eat is vegetables. I love vegetables. And I want to have my own garden in my backyard someday. But we're starting off at our school. We're growing vegetables right now at this moment. And it's as simple as going up to a local spot like my school, getting it for free, just to come back and make it for other people. And it's like, wow, I want this. Where did you get this from? Oh, it's as simple as growing it in your backyard. No money, that's all.
Fantastic. I remember that young lady from our session in Baton Rouge, Louisiana. She was powerful. So on to Dr. Janetta Bell Kelly, the new co-director for the USDA Nutrition Hub and the Nutrition and Health Outreach Specialist at the Southern University Agricultural Research and Extension Center in Baton Rouge, Louisiana. Wow, that is a mouthful, Dr. Bell Kelly. She obtained her bachelor's degree from Southern University, her master's of public health from Hofstra University School of Law, and her doctorate in health sciences from Nova Southeastern University. Dr. Bell Kelly has served as the Vice President of Strategic Community Partnerships and Health Equity Research at Northwell Health in New York City, where she built programs and initiatives to address disparities throughout New York communities. And she more recently served as Deputy Director of the Louisiana Department of Health's Office of Community Partnerships and Health Equity. But Janetta is now working with USDA as the co-director of our first USDA Nutrition Hub. Welcome, Dr. Bell Kelly. Please share your reflections on the listening session held in Baton Rouge and what great plans you have for the Nutrition Hub at Southern University.
Thank you for having me. Thanks for the wonderful introduction. And as the newest member of this team, I'm very honored to serve alongside colleagues in public health, as well as community education, and use individualized approaches to actually guide the community and the resources to better health. And similar to your background, Ms. Jacobs-Young's, Louisiana is a part of the very fattening, unhealthy comfort food tradition, as you all know. Everything is fried, everything is drowned in gravy or some rich, wonderfully tasting sauce, powdered sugar, topped off with lots of alcohol. So Southern University is steeped in the Louisiana tradition. So this is one of the best places to start a pilot program, because the success of a program here will be a blueprint for how other programs around the country can actually design their programs. So our testimony of better health outcomes will hopefully influence change and change lives across the country. So as you all know, I just came on board, so I was not in attendance at the previous Ascend event. However, reviewing the notes and looking at the videos and viewing feedback, some of the messaging that I got back was that similar to my co-panelist Edwin Kitz's experience, one of the greatest issue was the lack of accessibility, of course. Not having, living in food deserts, not having grocery stores and healthy food options around. Also, it's a reduction in alternative local options, such as farmers markets, fruit stands, mobile food trucks. And another was the high cost of nutritious foods. These were great problems that many of the attendants and participants spoke about, and we all know that these are issues across the country. Another issue which showed a great generational gap was that older generations consume more print ads and more printed information when it comes to nutrition education. They like to look at community boards. They like to read information and take it home and let it sit on the table for a while and pick it back up and look at it and call a phone number and reach out directly with someone to consume information. However, the younger generation is more into social media and online educational tools. You have reels, you have pictures, you have all types of other motivations online that would attract younger generations. A third question, the barrier to healthy eating, which is no surprise to Louisiana, there is a desire to have healthier food that actually tastes good. So there is kind of a cultural divide in understanding the differences, or understanding that there are ways to make healthy food taste great. There are wonderful seasonings and seasoning alternatives that folks can use to make their foods tasty, but good for them. There's also no desire to eat healthy. Some have the mindset of, well, I'll die of something in one day. So understanding that we have to help folks understand their why is a point that we have to bring across to the community. Another point was there's too much information out there. People are confused. One day you hear tomatoes aren't good for you. Another day you hear they are good for you. So eat 1,000 of them a day. A lot of people want that information to be consolidated into a data-driven message that can be followed and can be sustained. The other was what helps you lead a healthy lifestyle. So a lot of people commented that receiving a bad health diagnosis actually gave them a motivation to go ahead and take the plunge and start eating healthier, start getting more physically active. One thing that I found was interesting, that out of 127 responses, only 4 related to being a good role model for children and teaching them to eat healthy so they can make the right choices. This is concerning because, as we know, our future generations will determine how their children, how their offspring will consume food, how they will exercise and become physically active. So that was a point that resonated with me, that we have a lot of work to do when it comes to the why of building healthier generations. The last point was what would encourage and discourage you from participating in a food nutrition research study. The encouragement is that a lot of people think that having a learning tool will create sustainability. So that's good news. It shows that people actually want to not only eat healthy, they're not interested in fad diets, they want something that's going to work and last. What would discourage some participants was being judged and labeled as unhealthy. They don't want to be talked down to. They don't want people to lecture them about eating too many beignets or too much fried crawfish or po' boys or what have you. They want to be able to leverage the foods that they love and add in foods that are healthy and bring in physical exercise and activity. Also, the time of year. As we know, there are lots of festivals here in Louisiana, heavy eating months. It's not just Christmas and Thanksgiving. There's a festival for every type of food you can think of here, as you know. So a lot of participants don't want to conflict with that. They also find that there's not enough time to participate because of their busy schedules. They also fear that they will fail in these areas of becoming healthier. And also one outstanding issue was the lack of trust, not wanting their data to be used for research. So there were lots of issues that we learned during that time. But from that, we look at the relationship that we have with the USDA Nutrition Hub. And we're going to work to define a new architecture to better integrate and coordinate collective work of research, the extension and education agencies to actually improve food and nutrition security and reduce the burden of diet-related chronic diseases. So you say, how do we do that, right? So there are 4 pillars. It's building current and future workforce capacity for transdisciplinary approaches between research and extension. We are developing collaborations and partnerships with organizations. The third overarching goal is to develop and disseminate science-based nutrition information, and also fostering research and training opportunities in human nutrition research. So what are we actually going to do about it? So what's been happening so far? a lot of internal work is being done. We are building the foundation. For example, finding the right team to do the job. We're still in the process of finding which organizations, which internal programs within our own institution are already involved in building better nutrition programs. We're recruiting stakeholders and collaborators to join us. And when we look at what we want to do, we realize that there will be challenges. We understand that previous interventions may not actually impact newer generations, as we spoke about before. What was done 10 or 20 years ago may not be successful now. So we have to be mindful of that. We know that communications, there's a whole new world of ways to communicate with newer generations. There are also non-traditional partnerships that we can use to better help articulate goals and programs and interventions. We also want to and plan to address the isms, the distrust and the harm that's done in disproportionately impacted communities so that we can actually bring forth a program that will be sustainable. So where we're going, we are decreasing the prevalence of metabolic disease and heart disease and cancer among Louisiana's low income and rural and communities of color. We're targeting research programs focused on vulnerable communities. We're building trust in communities that did not have trust in the government before. We are helping to educate and employ behavioral change in nutritive consumption, finding your why and meeting the individual where they actually are. We're going to make healthy foods more accessible. We plan to partner with rideshare programs to get community members to and from healthy food shops, and working with non-traditional businesses to actually dispatch mobile units of food to food desert areas. We are working on building a health-focused workforce committed to intentional positive impact in low income areas. For example, increasing ethnic health workforce to work on food innovation and research that actually appeals to cultural recipes and traditions. We're also going to advocate for healthier nutrition, physical activity, and environmental policies. That means working with our legislators to create safer environments for exercise and socialization. So as you can hear, we have a lot of work to do, but it can be done with the commitment, the positivity, and patience of our network. There is a long road ahead of us, but when we keep in our lines of sight the impact it will actually have on future generations, it will continue to be worth the sacrifice and hard work that we will put into this work. So I'm looking forward to working with you all and open to any questions at the end. Thanks so much for having me.
Thank you so much. Oh my gosh, wonderful, wonderful insight and information shared from the listening session there in Baton Rouge, Louisiana. Some real points that have really stuck with me here as well. So thank you to all of our panelists for sharing your personal experiences with us. Now it's time to hear from you, our listening audience, and then we will close with a special announcement. So please stay tuned for that. So please share your questions using the Zoom Q&A feature. I'll now turn it over to Dr. Mike Grusak, who will moderate the discussion. So take it away, Mike.
Thanks, Dr. Jacobs-Young. And as mentioned, please use the questions feature at the bottom of the Zoom screen. We'll try to get to as many questions as possible. In addition, our team will also provide an email address in the chat to our Ascend office. And if you would like to provide lengthier comments or perhaps something comes up after the event that you'd like to share with us, please use that email and we will look for those messages and respond as soon as we can. So with that, I'd like to go ahead and start some questions. And first, we have Andrea as well. Get her on the screen here. Thank you. So we have a few questions coming in, and I'll try to summarize and pull some of these together. But maybe as a first start for all of the speakers, people are wondering whether, we had these nice listening sessions. Was there any feedback that was received that really surprised you? Something that was really unexpected from the listening session? And anybody could could start with that. Andrea, it looks like you're, oh, go ahead, Joynetta, go ahead.
Oh, sorry. Well, one thing I highlighted before, again, I wasn't there, but when I was looking at the feedback, one thing that really surprised me was out of the 127 responses, only 4 were geared to wanting to do something for the next generation. Everything was very, very individualized, which is still good. You know, there's still a hope to do something for yourself, but thinking about the next generation, it kind of speaks to the work that we have to do with the current generation and their children. We know that their children will be the ones to kind of lead the way with how health and health outcomes will be in the future. So I just thought that was really interesting, how there was a lack of response about building a better future.
I can continue with what Dr. Bell said, working with the youth and how they expressed and the ideas that they brought to this topic and how they eloquently spoke about it was one of the things that was like very surprising to people. And I feel like was so important to understand, like Dr. Bell said, like understanding what youth like their ideas and how to get to them, and they're the future. So I feel like that was one of the most surprising things, and the feedback that I received during that experience.
Yes, for our session, we had there was a lot of interesting things, but again, just to sort of echo off those last two, I was surprised to see how much passion there was in the younger generation to create healthier food diets, but not just healthier, but culturally relevant and significant foods that aren't necessarily in the main diet today. So traditional foods like buffalo, more traditional foods like whole corn, things that native families ate for thousands of years before, and having those return in more in the diet, and what that would look like, and where to purchase those things. But it was very comforting to see like a lot of our youth want to be involved in that, to bring that back into the communities and start that process again. Thank you.
Great, thank you. And maybe following up on that, we have a couple questions here about, I mean, you mentioned the youth, and obviously, Andrea, yours was a youth event, but wondering whether younger participants in these listening sessions versus older participants, were there differences in their excitement for the discussion, their excitement for the whole concept of healthier eating? I was just wondering if there were any differences there that might be of interest to our listeners.
I would say like specifically not noticeable, not super noticeable, I would say, but I would say the youth is very excited, and they're so creative. They have so much energy and so much passion. In my event specifically, they fell in love with the topic. Even in the presentation, I had a delegate from Alaska that wanted to draw some like foods for the presentation. So he took the time and creative energy to put towards this presentation. It's like some people would say like, oh, it's just a drawing, but no, just for him to feel inspired and to use his talent to communicate and express his excitement towards the topic. I think it was something that is very important to highlight, just that excitement in general to learn more and be a part of this event and this topic in any sort of way. And again, just they wanted to do the research. They did the research, and the presentation was amazing. And when the federal agents saw the presentation and made their questions, at the end they reached out to me, and they were like, they were so energetic and they were so excited to know more, and they expressed themselves so confidently. So yeah, I would say like both of the generations were super excited, but I love the youth and they were just so into the topic. So I would say the youth were a bit more excited about it, but I might be a little bit biased.
Either the others have any comments on that, or we can go on. You know, one of the issues that got mentioned by all of you was accessibility as an issue. And I'm wondering if you might have more comments or things that have been done. Edwin, you mentioned in your tribal communities that this was a big issue. What efforts can be taken or have already been taken there to really help with that issue?
So I think it starts again from the ground up. We're teaching our students at our college. They have the access to learn about gardening and farming in their own communities, and also sort of education on what is nutritious and what kind of foods relate to poor health outcomes, and which foods relate to healthier lifestyles. And so the way we try to, you know, it's a slow process and it's going to take a while, but we start from the very beginning, and especially communities out in the middle of far away from city centers. There's a lot of movement right now for gardens and community gardens, and sort of food hubs are is taking place, so that there's a lot of interest, and it's just sort of beginning right now.
Anyone else like to respond to that? How to help with the accessibility issue?
For specifically for the youth in the presentation, they highlighted college students. It's very difficult to have the resources to go to college, and then you add the food aspect. A lot of youth in college, they eat unhealthy foods, fast foods, cheap food. So they mentioned that they should be a relief for students in college. Also, in high schools, not everyone has access to healthy foods in their homes. So maybe doing a community garden, collaboration with that could be something that could be better and more accessible for students. We even brought the idea of integrating into a class a field trip where they can go to a farmer's local garden or field, and they can bring like a crop with them, maybe let's say a tomato, and share with their family and get to know what farmers are in their communities, and also bring some stuff from time to time. So that was one of the things we mentioned.
Thank you. Joynetta?
Yes, hi. I'd just like to add to what both Edwin and Andrea said. Also, we're finding that small pot programs where you can teach children that community gardens don't have to be this lavish backyard or some venue in another area of town. It can be right in your kitchen or right on your balcony or your porch, using very small pots to actually plant tomatoes and carrots so that they can actually take ownership in what they're growing and watch something grow and then taste it. I actually started this program in New York with when I was working with Let's Move with the under the Obama administration, and it was a very interesting impact that it made. Kids who would normally eat Takis or honey buns or different types of candies all the time, when they actually saw that their tomato or their cucumber was actually sprouting from this little plant that sat in on the stoop, and they tasted it, they were very interested in what else can I grow and how else can I make this taste great. So that's one of the things that I'm really interested in seeing how the community reacts to that, bringing small potted programs into the education system, and the daycare system, and all of the areas that touch young people, just to introduce them to growing something and being responsible for it.
Thank you. We had a lot of discussion here about the youth, and Dr. Jacobs-Young also mentioned, the importance of getting our younger people, knowledgeable on this. A few questions have come in about some of the efforts going on, and maybe in particular with the Nutrition Hub that we have at Southern. What plans are there to really move some of this information into the school system to really help motivate our younger population?
Yeah, that's a great question, and that's one of the starts with the actual small pot program, putting the responsibility in the kids' lap, literally. Another area that I'm working on is addressing ACEs, adverse childhood experiences. Food actually impacts that. We as adults stress eat when things are terrible in our lives, or when we feel like we need some type of comfort, we'll just go open a bag of Doritos or something, and just next thing you know, it's all gone. Kids experience the same things. So we want to work with community counselors and school counselors to understand what's happening in the lives of children, the environments they are growing up in, their social determinants that they're actually dealing with every day when they wake up, when they go home, on the way home. What do you have access to? What snacks you have access to, and why you're consuming them? And does it make you feel good, or is it that that's the only thing that's available in your neighborhood? So those are some of the things that we're going to bring into the Department of Education here. Also, nutrition meal plans with schools. One of the great programs that started actually in Atlanta and New York were to introduce vegan or plant-based foods in the school system. There's something called a Meatless Monday or Vegan Thursdays in New York City that Mayor Eric Adams started. It gives children an option to see what a black bean burger looks like. And to give it a try. You never know, you might like it. So introducing those types of options in school systems will actually help kids see that, things can taste great, and their peers are right there tasting things alongside them. And again, the accessibility part of it, working with food banks and ensuring that there's accessibility. So if that means making sure a food bank is out to hand out boxes of fresh fruits and vegetables, and having folks on site or somewhere in community centers to do food demos on how to actually saute eggplant and make it really taste good. So there are lots of plans to begin with children and with that generation, because again, they are the ones who will determine what the future outcomes will be. So I really am passionate about working with the school systems to ensure that they have access.
Thank you. I think we have time for one more question here. Some questions have come in regarding, again, this issue of communicating to these communities. We're doing a community conversation today. Was fantastic to see. We had over 400 people on the call. A wonderful, interest in this topic. curious about, for any of your communities, the role of social media and in getting the word out. What possibilities do you see for enhancing that, or the type of messages that we should be getting out in through our social media to your communities? Andrea?
I think it's very important to highlight all the things that we just mentioned, not only a certain topic. I think what is the economics, the education part, the cultural part, the mental health aspect. Share all of those things that actually are important to the topic and how things are affecting that topic and how can we make it better. Where are the resources? Highlight all of this stuff is very important to engage with our communities. So I feel like if we put all these issues in different type of content, I think it would be easy to get to people and talk to them and also hear from them. What do they think? How can we make this better? I think listening goes a long way. So I feel like that would be a very essential way to communicate and use social media to engage with the community.
Thank you. I think we might need to cut it off there just because of time. So thanks to all of our panelists for a wonderful discussion. Thanks to all the questions that came in. I would reiterate, please look for our Ascend email. If you have additional comments, please send them in. But we're not done yet. I'm going to turn this over now to Dr. Jacobs-Young for some closing remarks and some very special announcements. So please stay with us. Dr. Jacobs-Young.
Thank you so much. Thank you, Mike. Thank you to all of our panelists. Wow, what a great conversation. And as a container producer myself who grows my vegetables in containers, I love the idea of introducing that to young people so they can have the experience of eating something that they've personally grown with their own two hands. Well, for all of us, I know I love it. So thank you so much for your questions. I've seen them come in. Just some very interesting questions, some very thought-provoking questions. Comments from you are key to us understanding communities' unique needs to strive to minimize health disparities and improve health outcomes in this country. It's important for us to engage communities and hear their personal experiences to better understand the unique challenges and opportunities that they face. We've heard from our panelists today and through our videos that there is no one-size-fits-all approach. It won't work if we want to make meaningful and impactful changes in communities that need it the most. That's why today I'm excited to announce that we are making $4.5 million in funding available to establish 3 additional USDA Nutrition Hubs. The 3 new Nutrition Hubs will provide tailored, effective, translatable, equitable, and scalable approaches to equitably advance food and nutrition security and reduce the burden of diet-related chronic diseases, especially in historically underserved at-risk communities. You've heard from Dr. Bell Kelly and some of the amazing work that's happening at our pilot nutrition hub. Now, these additional hubs will create a network that builds on that work established last year in partnership with Southern University under the Ascend for Better Health initiative. With funding from the National Institute of Food and Agriculture and Food Research Initiative, or NIFA, our nutrition hubs will focus on providing science-based information tailored to community populations across tribal, Hispanic, and insular areas. These nutrition hub networks will enhance USDA's collective effort to better understand real-world opportunities and challenges around nutrition and diet-related health disparities that impact at-risk communities the most. Equitable access to healthy, safe, and affordable foods that promote optimal health and well-being can have a significant impact in reducing rates of diet-related chronic diseases, including many cancers. So people need tailored tools, resources, and knowledge to be able to make an more active role in managing their nutrition and health to empower them. The Nutrition Hub Network will work with underserved communities to develop and share the latest science-based nutrition information to advance food and nutrition security in at-risk communities. We invite proposals from around the country. Details are available in the request for applications, and we're going to put a link right there in the chat for you today. If we want to positively change future health outcomes of our family, friends, and loved ones, and ultimately end cancer as we know it, we need to tailor and deliver information in a way that is practical and unique to the communities we serve. And that's the ultimate goal of Ascend and our Nutrition Hub network. Before we conclude today's webinar, please note that you can find links in the chat for more information about Ascend, President Biden's Cancer Moonshot, USDA's My Plate information, and of course, the new Nutrition Hub's request for applications. I also encourage you to follow USDA Science on X for the latest information on our efforts. Thank you again to our panelists and to all who joined us virtually today. This concludes our webinar. Have a great rest of your day. And remember that you can take health into your own hands, one bite at a time.